Hello guys, welcome back to the D&N Medical series. I'm Damar and I'm here with a brand new video this week. Now in today's video, I'm going to look on vaginal dryness, what are some causes and how you can fix this. So if you're interested in this video, please continue to watch. Remember to like, comment and subscribe to our YouTube channel and also to follow our Instagram page at D&N_Medical_series. So vaginal dryness is a very common problem, especially in women who are going through menopause, and this is because of hormonal changes. So the estrogen hormone is very important in producing this fluid and lubricating the vagina. If you have a decrease in estrogen, this can lead to vaginal dryness. There are other causes of vaginal dryness, such as not being stimulated properly, so there is no foreplay before intercourse, and this can lead to dryness of the vagina. Another non-hormonal cause of vaginal dryness is actually douching, and if you've watched our videos before, previous videos, we've talked about douching and how it can cause vaginal odors as well as discharge, and it is very bad for the vagina if you douche, because this affects the pH of the vagina and certain organisms can grow and cause infection. So you don't want to douche because it can also cause irritation of the vagina, and this can lead to vaginal dryness as well. So we're going to look on the more common causes of vaginal dryness, and these are your hormonal causes. And remember, we said that this has to do with low estrogen levels. So anything that affects your estrogen level can cause vaginal dryness. The more common things are: one, you're in menopause. So menopause can decrease your estrogen level, and you can look for other symptoms such as: have you missed your cycle for more than 6 months to a year? Are you having hot flashes, vaginal symptoms, mood change, changing sleep pattern, changing appearance? So autoimmune diseases can also cause vaginal dryness. These include your Hashimoto's disease, Graves' disease, psoriasis, vitiligo and eczema, as well as celiac disease, rheumatoid arthritis and lupus. But the most common autoimmune condition that causes vaginal dryness is your Sjogren's syndrome. Alright, and this not only causes vaginal dryness but dryness of your mouth, eyes and other areas of the body. Persons who have had childbirth recently, they can have a decrease in estrogen after the birth of the baby, and this can also cause vaginal dryness. Also, mothers who are breastfeeding, usually they'll have a low amount of estrogen as well, and this can contribute to vaginal dryness. Other causes could be things which directly affect the fallopian tubes or the ovaries, and these include chemotherapy or removal of your fallopian tubes and ovary called oophorectomy. Also, another cause would be smoking. Alright, so smoking can also decrease your estrogen level, and this can lead to vaginal dryness in females who do smoke. So what are the treatment options for persons who have vaginal dryness? First, you have to know if it is hormonal or non-hormonal causes. So for example, if it's non-hormonal causes, just stop douching. Also ensure that you get enough stimulation before taking part in intercourse. But if there is an hormonal cause, you may want to start off with a vaginal moisturizer and apply to it every few days or every day if you would like, and these include KY liquid beads or replens. You can also use vaginal lubricant, so KY jelly is also used at the time of having sex, or Astroglide. Those are types of lubricants that is safe for the vagina. Also, you can get a low dose vaginal estrogen cream, tablet or ring, and this is to help with just the hormone. Remember, estrogen is very important, and higher levels of estrogen can help with lubrication. There are other prescribed medication such as ospemifene as well as tamoxifen, and these can increase your estrogen level. But you can go ahead and ask your doctor about these medication. Sometimes these medications are not suitable for persons who have had breast cancer or persons who are at high risk of breast cancer because of the estrogen level. So you can ask your doctor more about this, and thank you so much for listening to this video. See you in the next one. Goodbye.